In this video, I'm going to talk about the vessels of the lower limb, so vessels of the leg. And we're going to start with the arteries. So as we're traveling from the heart, we're going to go down the abdominal aorta. And that abdominal aorta is going to split right basically as we reach the pelvis. And that split is into what we call the common iliac. And remember, anytime anything's called common, that means it's shared, which means it's going to split again. In this case, it's going to split into an internal iliac. And this internal iliac is going to feed the internal structures of the pelvis. So it's going to kind of keep splitting. And these branches are going to be branches such as this one here. This would be the uterine branch, which would feed the uterus. Wouldn't it be great if it fed the elbow? That would just be kind of funny. The vaginal branch, the middle rectal branch. So basically feeding these internal structures of the pelvis from that internal iliac. Now, another branch of this would be the pudendal. And the pudendal is that one that serves the external genitalia, which is a really important one as well. All right. We also, from that internal iliac, have a branch that goes out along the iliac crest called the iliolumbar. This is going to serve the muscles along the pelvis. And as we go further down, well, we have more splits in that internal, but we want to focus on the limbs here. So the other end of the split is going to be the external iliac. And as the external iliac goes down, it's going to change names again. And when it changes names again, it's going to become the femoral. And this happens right as it's along the femur. That femoral splits into, or it stays as the femoral, and it has another branch that's called the profunda femoris, which would be the deep femoral. And one thing I want you to notice is right along this profunda femoris, just like what we noticed with deep brachial, or actually not even deep brachial, it came off the axillary, we have a circumflex. We have a little artery that wraps that ball joint. And remember, circumflex just means it wraps it. This profunda femoral, profunda femoral. So that circumflex, in addition to wrapping the joint, in this case we have one that continues on deeper. That's the lateral circumflex. Along with the profunda femoral, these service those deep structures of the lower leg. If you think about your lower leg, the reason it's going to have more of these deep vessels is because it's going to be, it's larger than your arm, so it's going to need a little bit more blood flow to get blood to all these deep things. All right, so the majority of the blood going to the lower leg is going to come through the femoral artery. And as that femoral artery goes down, it's going to reach the knee, and once we reach the knee, it's going to split. And again, it's going to be named after the region it's in. The name for the region of your knee is popliteal, and guess what? That's what it becomes named here. So it's popliteal artery. And if you were ever asked to get a popliteal pulse, guess where you'd go? Right behind the knee, and this is the artery you'd be feeling. If you went for a femoral pulse, you'd be going on the femoral artery. All right. In addition, you've got these little arteries that wrap the knee. These are called the geniculars, and in our class, I just grouped the genicular arteries together as a set. Now, you do technically have lateral geniculars. Whoops, I'm not very good at grabbing these with visible body. You have lateral geniculars and you have medial geniculars. I kind of just say, hey, if it wraps the knee, it's genicular. because really what these guys are doing is they are servicing the area around the knee, and then they're just named by where they are. Lateral superior is on the outside and it's on the femur because it's the top bone. Inferior medial is going to be on the tibia and lower. So there you go. All right. Now, as we continue on down past the popliteal, what I want you to notice is the first branch goes off to the front. First branch goes anterior and it goes along the tibia. This branch is going to end up servicing the top of the foot. And it's going to do that much like what we saw with the hands, where it's going to end up feeding basically an arch. So it'll feed the tarsal, basically the tarsal branch, and then the arch, and then it'll go out to the digital. Just below where we go to that anterior tibial, there's a split to the posterior tibial. And posterior tibial is going to service the bottom of the foot, and the blood flow on the bottom of the foot is very similar. It's going to flow again. You're going to have to, whoops, oh, geez, I'm having a heck of a time with visible body today. It's going to flow to the arches, arch across in anastomosis, and then that blood is going to go to the digits. Now, just after that split into the posterior tibial, you have another split into the fibular artery. And fibular is also known as peroneal. This is not to be confused as perineal, which is another word for basically anything filling that hole in the pelvis, which is where the sun don't shine. So I don't want you to get those terms mixed up, and so I'm going to make a big deal out of it, because if you had to palpate someone's peroneal area and you're feeling their lower leg, that's not really a big deal. But if you mess up and you feel their perineal region, that might be a problem. So let's just keep it straight today, okay? All right, so once again with the veins, we're lucky in that we have a lot of similarities between veins and arteries. But there are some important differences once again. So you do start going down the leg with this common iliac split, where again you split into an internal, which drains the structures internal to the pelvis, and an external, which would go down the leg, or actually drain the structures from the leg. All right. Now, that external is going to become the femoral vein, and that femoral vein, and this is sort of where, to me, it gets reminiscent to the arm. Do you remember we got into that axillary region of the arm, and all of a sudden we had the cephalic vein? Here we have a new vein as well. We've got the great saphenous vein, and this great saphenous vein is amazing. It actually runs the entire length of the leg. So if you were to look at the leg, and I'm going to trace it here just because I feel like this blue on blue thing does not work for us. Here, this great saphenous vein runs this whole length of the leg here. So it's a huge, huge, huge vein. And its job is to drain the superficial structures of the leg. So basically the skin and the more so superficial muscles of that leg. All right. And it's going to drain those and eventually lead up to that femoral vein. Once again, we also have a deep femoral vein, and that's going to drain the deep structures. And then we've got our regular femoral vein, and our femoral vein is going to go down the leg. As it's going down the leg and it hits the knee region, it will again change its name to the popliteal. Popliteal is going to have a new branch because it can't be easy, can it? And this is the small saphenous vein. And the small saphenous vein just does the back of the leg. So he's right here. So it's just like the calf. And this again is one that just drains the superficial structures of the leg. And small saphenous is a small region. It only does the back of the leg. All right. Then we have that popliteal splitting into that anterior tibial and posterior tibial. Now I want you to notice that here, instead of the anterior split occurring much earlier than the posterior, they're kind of at the same level. So here's the anterior split and the posterior split. And then you've got that posterior once again splitting into that fibular or peroneal. And these are the ones we tend to worry about when we worry about those deep vein thromboses, which is where someone gets a clot in one of their veins of their lower leg because they've been sitting for too long. And because the pressure isn't very high, if the blood sits for a long time and it's not moving, it has a chance to set up and clot, and then there's no blood flow. And if there's no blood flow, that's bad. Waste will build up and nutrients cannot get there depending on if it's the incoming or outgoing blood that's stopped up. All right. So once we get down to the foot, once again, anterior serves the top of the foot, and it'll go through this dorsal venous arch. That'll go to the digital veins, and the posterior goes basically through a lateral plantar and a medial plantar vein, and then those come together through the arch and go to a bunch of digital veins. And basically everything's going to go from those digital veins to the arches, to the tibial and fibular vein, from there to that popliteal, which would be right here, back of the knee. Back of the knee. And from that popliteal to the femoral. Now this is all if it's something deep. If it's something superficial, it may just go straight into that saphenous vein and reach the femoral that way. And then from that femoral, it's going to make it into the external iliac, and then into the common iliac, and then into the inferior vena cava, and back to the heart.